Welcome to Health Planning, an executive discussion series from Abacus Insights focusing on the issues and opportunities facing payers today in this ever-changing healthcare environment. My name is Minal, Patel. It's my distinct pleasure to welcome Mohamed Diab to our show today. Mohamed is a physician and currently serves as the president of CVS Accountable Care. Mohamed, welcome.
Thank you, Minal. Thank you very much for having me.
Mohamed, you're a physician, an obstetrician, if I remember correctly, and now you serve as the president of an incredible organization serving countless number of beneficiaries, 70,000 providers in the U.S. How did you get here? What was your journey?
I've been in the healthcare industry for decades as a provider of care, as a physician, as you mentioned, working for the payer industry for quite some time, doing a lot of consulting for large health systems and clinically integrated networks. And for this experience, I realized that our fee-for-service system is fragmented and dysfunctional. And it's not working for the physician, it's not working for the patients, it's not producing the outcomes, the high-quality outcome that we're all looking for as a society. That's why I believed in this mission of supporting the provider community in this journey from fee-for-service to value-based care. We created this organization, CVS Accountable Care, to be supportive of and enabling the provider community, especially primary care physicians, in this transformation journey, which is very hard and complex and requires significant investment in technology and analytics and clinical programs and resources. So that's how I got here.
Obviously, data is core to making sure your analytics have value and veracity. Comment on your assessment of the state of data and the quality of data that exists in the industry today, and then specifically, what at CVS are you doing that hopefully makes that better?
We're definitely not where we want to be as an industry when it comes to our healthcare data. So we are missing a big component of this data, social determinants of health data, in a meaningful way, which is you cannot be able to manage a population without having a complete understanding of what's going on in their lives beyond just the diagnosis code or the CPT code. So, and the lack of national standards of this data also become a challenge. And the interoperability and the connection between the various electronic health record systems. So in our partners, today I'm dealing with 100 different versions of electronic health records, which makes it very hard from an interoperability standpoint and connecting the dots and getting the full picture of what's going on in this patient's life.
Why do you think more executives are not recognizing this fundamental structural barrier, particularly in a world where all this technology and money is being thrown at AI and large language models?
It is not easy, but everybody needs to speak up about the need for better data. And we've been discussing this with our partners. We've been discussing this with the federal government about the need to have the data. We tried to do our part by actually reaching out to our beneficiaries and start collecting the data, the data pieces that are missing, and also working with our various provider partners and trying to get extracts from the electronic health records so we can complement and have a full picture of the population that drive the analytics and drive the stratification and segmentation of the patient population so we can manage the population in a more efficient and effective way.
I fully agree with you that the fee-for-service system is broken and the risk-bearing relationships are the way forward to really align incentives. What advice do you have for others that are either on this journey, beginning this journey, struggling with this journey in order to try to get to the right place where you seem to be today?
CMS just announced that they are looking to have 100% of Medicare beneficiaries in value-based care or accountable care by year 2030. So this is around the corner, And the provider community need to really realize that this is coming. And not only the federal government, but all the private payers are also looking to work with the provider in value-based care. So this is the time where we all need to step up and really join the cause and the mission and stay the course and improve over time. It's an incremental improvement, but the outcome is very promising with better quality and lower cost. And people need to understand that this is a journey that you need to invest in time and effort and dollars to get there. But the second advice is you don't have to go alone in this journey. So, working with a partner that can support you and can enable you to accelerate your journey, it will make it faster and easier and less costly and more efficient.
Mohamed, thank you for your comments today, not just for my payer listeners, but for anyone, including providers who are entering into value-based relationships with their partners. Your comments and experience are really, really insightful. To our listeners, thank you for tuning in. I hope you'll join me for a future episode of Health Planning, where we get to talk about some of the most important issues and challenges facing payers in this ever-changing healthcare environment. My name is Minal Patel.